Imagine being told that you were not allowed to access a private surgical facility in Canada because of where you lived. Today, we're going to be talking with an Edmonton patient that faced such a situation. And we're also going to explore the broader issue in Canada of bans on private healthcare. What does the law say, and where are patients allowed to actually access private surgery? So let's start off with Jeff Krushell. He's a patient from Edmonton. And Jeff, thanks for taking a few minutes to chat today.
Yeah, no, my pleasure. Glad to have this conversation, Colin.
So, Jeff, why don't we start off with the beginning? You ran into some back issues and then had to access Canada's public healthcare system. Could you tell us a little bit about that?
Yeah, I think I fall into that category of about 80% of Canadians and Canadian adults who will experience some form of back pain in their lives. Unfortunately, I drifted into that top 10% where I actually needed a surgical intervention to correct the issue, which was a deterioration of the disc between lumbar vertebrae 3 and 4. So I actually needed, at the end of the day, a spinal fusion, which turned out to be the big challenge, Colin.
And so, what happened when you went to speak with your family doctor, the public system? What kind of a wait time were you facing?
Yeah, well, here's what I can say. I've over this last couple of years, I've been sort of caught up in both sides of the healthcare system. The glory of it all, which is the incredible professionals inside of that system. Our family doctor is great, and I was having back issues, and for the most part, 90+% of the back issues that we'll see, we can correct through just preventative exercises and medicine. So that was the first approach, but it deteriorated to the point where I was seeing a therapist and then a sports medicine doctor. And we actually were able to work it and maybe prolong the situation probably for 6 or 7 months because we thought we could correct it. We didn't know we had to go the surgical route till later on. But when it did deteriorate, an MRI and an X-ray showed that this was beyond, just the general exercise, core work, preventative stuff to get it back on track. I needed some eyes on it. So at that point in time, we're getting into maybe late 2021 into 2022 now. The pain started to get very, very serious and almost unbearable at times. I got into my first cortisone to see if we couldn't break that pain cycle a little bit to get me back on track in terms of rehab, but the rehab wasn't working. So I eventually got a referral to a neurologist. Now, there's a story leading up to that because this is sort of in the midst of the COVID madness. We're sort of off and on. Nobody's sure how this thing was winding up or unrolling out, so to speak, in terms of medical care, getting to clinics, seeing patients. Some of it was virtual. So we were dealing with all of that. But I was in pain and the pain was getting pretty severe and maybe cursed me a little bit because I was trying to put on a strong front and maybe not let people know how much pain I was actually in. But by the time
Mm-hmm.
I actually got the referral to the neurosurgeon, man, I had trouble standing. I had trouble sitting. I sometimes couldn't lay down. And I got into this sort of self-prescribed scream thing. You could talk to my family, the horrific sounds coming from the basement, because it's the only way I could deal with the severity of the
Mm.
pain. And so I get the referral, and I'm just not sure when that appointment's going to be. And I was in a dark place. I'm a very positive person, Colin. You can ask anybody. I've dealt with
Mm-hmm.
my world is sport performance. I've dealt with athletes, anxiety, depression. I have never experienced it myself, but I was well within the grips of this monster that's chronic pain. So I have an incredible appreciation for it now. But I slipped into some dark
Mm-hmm.
places. That referral to the neurologist was a ray of hope, and it really did lift me up. Not knowing when I would
Mm-hmm.
get that appointment was frustrating after a couple of weeks. But when I got the call for the appointment, it was like a weight
Mm-hmm.
had been lifted off of my shoulders at that point.
So, just quickly, how long were you looking at a wait in the public system before you would actually get surgery?
Well, I think by the for the surgery, well, here's this next part of the story. I got in to see the neurologist. Excellent. I was kind of nervous. I never had a major surgery myself now, but the surgeon was dynamite, and without question, he agreed I needed a spinal vertebral fusion.